With the temporary shutdown of the US economy, 16.8 million Americans have filed for unemployment. Many are in deep financial hardships, straining aid for those in need and drastically increasing homelessness. People who work 2 or 3 jobs to make ends meet are not able to pay the rent and are forced to move onto their streets. Hello, this is Agni Rajnikant from Shawls for Shelter's nonprofit foundation, here to talk to you about the drastic impact the coronavirus has on the homeless population. The Center for Disease Control and Prevention identifies people experiencing homelessness as one of the highest at risks for the COVID-19 pandemic. This group is at a higher risk than others due to the lack of proper nutrition, sleep, and their pre-existing health conditions. Many are even without the ability to wash their hands or clean themselves because most public areas are closed. The CDC has also warned that older adults are more at risk to the virus due to their weakened immune systems. Studies from the Gerontologist Society of America have shown that the homeless population ages faster than others. Many homeless people around the age of 50 have shown to experience conditions like those that people around the age of 70 experience, such as memory loss and physical impairments. According to the Homelessness Research Institute, the majority of the homeless also have pre-existing medical conditions, making it extremely difficult for them to cope with the COVID-19 pandemic. In the category of physical health problems, 84% of sheltered homeless people have this problem, while 19% of unsheltered people have this problem. In the category of mental health problems, 78% of sheltered people have this problem, while 50% of unsheltered people have this problem. In the category of substance abuse conditions, 75% of sheltered people share this problem, while 13% of unsheltered people share this problem. Another fact that makes matters worse is that a majority of the homeless population is unsheltered. Every night, more than 175,000 homeless people are without a roof over their heads. And the people that are sheltered are stuck in crowded areas, making social distancing and quarantining extremely difficult. Many shelters are also unable to cope with increasing demand for medical supplies. In order to prevent the virus, homeless shelters are in dire need of masks, wipes, hand sanitizers, toilet paper, disinfectant, and other cleaning materials. The homeless population that is unsheltered can't even self-quarantine themselves because they don't have a roof over their heads. They depend on people, and they depend on others, and they depend on charities and foundations to help them with their needs. There are currently 9,303 homeless citizens in the state of New Jersey. Many, due to the coronavirus pandemic, have been struck with fear, clinging to the small hope that someone will help them. The New Jersey government has secured multiple hotel rooms in order to quarantine the homeless, but it is not enough. The amount of rooms given is inadequate to accommodate the sharply rising homeless. And in order to help solve this crisis, Shawls for Shelters Foundation is hosting a homelessness outreach program. We are doing our first fundraiser in order to help provide quality medical supplies for homeless shelters to use. We aim to raise more than $5,000 to help New Jersey homeless shelters and the homeless population. Please go to shawlsforshelters.org for more information and how to donate. Please like and subscribe and show your support to the homeless and to Shawls for Shelters Foundation. To the homeless, to the people. See you later.